The mitral valve is located between the left atrium, the upper left chamber of the heart, and the left ventricle, the lower left chamber of the heart. Traditional surgical mitral valve replacement and repair are open-heart surgical procedures to treat the mitral valve that may be damaged and is not working properly. When the mitral valve does not work properly, the heart will have to overwork to supply the body with oxygenated blood. Mitral valve stenosis, a narrowing of the mitral valve, and tears in the mitral valve leaflets could be indications for mitral valve surgery. The decision to replace or repair the mitral valve depends on the severity of the mitral valve disease. The damaged mitral valve may be repaired by tightening the ring around the valve, closing tears or holes in the valve, separating fused valve cusps, or adding support to the valve. Repairing the damaged mitral valve can restore normal blood flow in the heart. The damaged mitral valve may also be replaced with a mechanical or a biological tissue valve, restoring normal blood flow within the heart.